Keep our patients safe, the role of the patient safety assistant. My name is Melody Routley. I'm a nursing professional development specialist for the Kaiser Permanente Northwest Regional Hospitals. Patient Safety Assistant, or PSA, is a nurse, CNE2, or ED tech that is used to ensure the safety of our at-risk patients in specific situations. PSA need is determined by the patient's nurse and charge nurse and approved by the manager or hospital administrative supervisor. We have used PSAs for patients who are at risk for suicide, psychotic patients, patients who are disruptive or have poor judgment, and patients who might be impulsive or wander. All alternatives must be tried before we use a PSA. Thinking about reversible causes for confusion and agitation, think to yourself, is my patient in any pain or do they have discomfort? Do they have any elimination needs, or do they have urinary retention or may be having a fecal impaction? What about eyeglasses, hearing aids, or dentures? Do we have those on? Is my patient sleep deprived? Am I providing a healing environment so that my patient can get enough rest? And does my patient have an infection? Were they admitted with pneumonia or cellulitis, or do they have an underlying urinary tract infection? These are all causes for confusion and agitation that can be reversed. Other strategies is removing any lines or drains. Taking Foley catheters and removing saline locks can help. Offering diversional activities for your patients. Moving the patient closer to the nurse's station can help. Having a toileting schedule or increasing your hourly rounding can also be used. The PSA role: always get report from the patient's primary nurse. You need to know, why does this patient need a PSA, and are there any specific safety needs that you need to be aware of? What are the expected care needs? Are you providing the patient with a bath? Are you helping them with their meals? What is expected of you? And then what should you report to the nurse? You're there to maintain a safe environment. That means keeping that patient in your line of sight and not leaving the room. Make sure your patient's nurse is informed of any patient status or changes. That's behavioral, mental, or physical. And then immediately notify your patient's nurse, or the charge nurse even, if your patient attempts to leave. That being said, never put yourself in any harm's way or any risk. And then follow all the nurse's delegated activities. There are a few documentation pieces that you need to be aware of. One of them is the patient safety documentation form. This form is used every 24 hours to document patient behaviors seen. So if you see your patient hitting and kicking, you put a tick mark. If you see them pulling lines and drains, you put a tick mark. This form is used at the end of your shift for your summary. Additionally, you need to document how much your patient is sleeping. So if they're sleeping at least 15 minutes during the hour, you put a mark. This sheet is not part of the permanent medical record. It's only used for you to document at the end of shift. If your patient's in restraints, you're going to be asked to document on the restraint flow sheet. A shift summary note is used at the end of your shift to document what your patient had. You're using the Patient Safety Assistant documentation in your summary note. From your CNA Navigator, you can select notes, and in the Insert Smart Text box, type in PSA. This generates the Patient Safety Assistant documentation note. Using this particular note, document all of the behaviors that you see in your patient. In this particular note, I observed the patient pulling on their tubes and lines ×4, and I know that the patient attempted to get out of bed 10 times. But the patient did sleep. They slept at 7, 10, and 2 o'clock. I also wrote a brief note that the patient's daughter was visiting today, and the patient actually pulled on her Foley catheter and feeding tube less when the daughter was in the room. I added any additional information that might contribute to the plan of care or help communicate the patient's preferences for the next PSA. There are some additional safety needs that you need to know about when taking care of a patient at risk for suicide, and one of them is level of observation. There are 2 levels of observation. One is when the bathroom door is just slightly open so that you can hear any unusual activity and then discreetly observe the patient. The other one is the bathroom door is wide open and you're present to observe a part of the body so that you can intervene very quickly if you have any questionable patient behaviors. With suicide patients, you don't allow visitors unless they're approved with the patient's nurse. And even if the patient has visitors or family, you never leave the patient. And only allow the patient to access their belongings if the patient's nurse gives permission for that. The patient's belongings are collected and stored and locked in the close observation carts, along with any room equipment that was removed for safety. The room is reviewed to make sure that it is a safe environment of care for that patient. So we might be removing pieces of equipment, tubing, cords, things of that nature. At the change of shift, the PSAs do a room safety check together. With suicide patients, you want to minimize your conversations and never share any personal information about you with the patient. Do not argue or express your opinions with the patient. This is not the time to discuss political viewpoints or religious opinions. Always be respectful and supportive of the patient, verbally and non-verbally. Remember that you're there to keep that patient safe, so make sure that you're not doing anything that's going to jeopardize the patient's safety, like sleeping, being distracted by using social media or making and receiving personal phone calls or text messages. And only the patient is the one that gets to watch TV, not you. So if the TV is making a distraction for the patient, you may not want to use it. Remember that you're there to keep the patient safe.